good morning. Happy Friday. It's nice and pretty and sunny outside. I hope you guys have some good plans for the weekend. This is our first edition of an MMG update, and I'm here with Dr. John Gisla, who's going to be providing an update on the state of COVID, pretty much globally as well as locally. So, John, I appreciate you being here with us today, and thanks so much for making time. So,
Morning, Peter.
And just to let you guys know that we don't have our masks on so you can hear us speak better. We've both been vaccinated and we are socially distanced, so please know that we're taking that seriously. So John, can you kind of give us an update on what's the status of COVID vaccine across the world?
Of the cases.
Of the cases across the world.
Absolutely. So it's a similar trend. If we look globally, you'll see that there was a surge of cases that occurred in December, stretching into January. But then into February, you'll notice that the cases have been coming down. If we jump into the US, very similar trend, surge a little bit later in January, but coming down into March. And then we move on to California. Again, similar kind of trend that you'll see, cases decreasing, and as a result, the economy opening up a little bit.
Great. So it looks like we're actually going in the right direction.
Yeah, I would agree.
Okay. So John, how are we doing more in our backyard? How are we doing locally? And kind of what are some of the efforts that we have going on?
I have a couple graphics to share, Peter, that I think will be helpful. The first one looks at Sacramento County COVID-19 cases, and you'll see here that the cases surged in December into January. The blue line is a rolling 7-day average. And cases, I think, are interesting, although it is significantly dependent upon testing capacity and testing availability. The more you test, obviously, the more cases you'll diagnose. What I like are looking at the actual hospitalization COVID cases. And so you'll see on this graphic right here, the upper line is the total number of hospitalized patients in Sacramento County across all health systems. The bottom line are the ICU cases. So again, that similar surge we saw in December, falling down in February. You'll notice that surge that we had last summer also not quite as high as the late in the year surge, although there were a proportionally higher number of ICU cases earlier. So with the second surge, we got a little better at keeping patients out of the ICU and off the ventilators, which is a good thing.
Great.
This graphic that I have right here is the Greater Sacramento Division hospitals, so the Mercy 6 hospitals, the Dignity 6 hospitals, and this is our latest numbers. All good news, hospitalized cases coming down, that's that top bar. The red bar down at the bottom are the new admitted COVID cases that day. And just for reference, this next graphic looks at the surge that we had in January, and you'll see that the peak volume for the Greater Sacramento Division hospitals was around 240 hospitalized patients on January 7th, and then again falling as we got into the new year.
Well, that's definitely some positive strides. So how are we doing? What is it that we're doing as part of the medical group and the foundation to kind of help with our vaccine efforts, and maybe even give us a little information on some of the things that we've done locally with some of our underserved population?
Yeah, excellent question. So first graphic I'd like to show is how the world is doing, or how countries throughout the world are doing in terms of percentage of their population, or essentially doses per 100 people that are being administered. And you'll notice on this graphic that Israel's doing a great job. You can see those other countries in the United States, about 24, 25 patients per 100 have received a vaccine. So, not bad, but certainly not as good as a number of other countries, developed countries in the world. In terms of how we're doing in the medical group, we're doing relatively well. This next graphic here shows that we've deployed about a little over 16,000 doses of vaccine, which is excellent. We have 4 centrally located, geographically located vaccine sites that are running very well. Our clinicians are volunteering to work on the weekends, and our regular staff are doing extra shifts to make this happen. We have had some issues with a stable supply of vaccine, but overall I think we've been doing well. We haven't had to cancel any cases or any vaccine appointments, as have some of the other health systems.
Wow, that's great.
You mentioned equity, and I'm happy to say that through the efforts of some of our leadership in this regard, Dr. Roberts, Dr. Diven, we've done remarkably well in terms of deploying vaccine into vulnerable populations. If you look at this next graphic, this compares vaccine deployment in mid-February with vaccine deployment currently in March. And you'll see that amongst our patients, overall 65 and above, we've vaccinated 16.5% in February, up to a little over 18% in March. And you'll notice that vaccine deployment amongst various vulnerable populations has been better than average for us. So if you look at vaccine deployment amongst vulnerable zip codes, from 26% up to 29%, and looking at vaccine deployment in patients 65 and older who belong to Black, Latinx, and Native populations who live in those zip codes, even better, 27% and 31% recently. And then finally, looking at our population as a whole, comparing vaccine deployment to all our patients 65 and above, compared to vaccine deployment in those target populations that are high risk, Black, Latinx, and Native populations who are 65 and older, better than the average, 23% compared to 16% in February, 23% compared to 18% early in March.
Wow, that's really impressive. So, John, I understand we're still continuing our weekend vaccine clinics. Can you kind of give us an idea of where those clinics are and what our physicians need to do to get their patients set up and who we're vaccinating right now?
Yeah, another great question. Thanks, Peter. So we have 4 geographically located vaccine clinics, beginning in the north area, our Citrus Heights location, coming east to Folsom, and then our Midtown location, and then further south at Weimar. And these 4 clinics deliver first doses on Saturdays and second doses on Sundays. Currently, the medical group is vaccinating any of our patients who are 65 and older. And this is consistent with public health guidelines. And this can be patients seen by either primary care doctors or our specialists. They don't have to have primary care through Mercy Medical Group. Now, in addition, towards the end of each clinic, we often have residual vaccine doses that we have to either administer or they get wasted. And so we have a list of patients who are not MMG patients, 65 and older. And this week also we're collecting names of patients who qualify based upon their occupation. And so this includes first responders, teachers, licensed child care workers, and the like. So please send us those names. If you look at my recent email, the information that we need, a name, phone number, and how they qualify, because we like to call these patients over the last few hours of the vaccine clinic when we have residual doses, and if they can come in quickly to receive a dose, it's good for them and it helps us avoid wasting vaccine.
Sure. Well, thanks so much for leading that, John. And I think it'd be great for you to actually even mention the leaders who've been running those clinics. It'd be nice to get a little shout out for them as well.
Absolutely. Could not do it without their efforts. So in the north area, Citrus Heights, Dr. Shahed Reza, one of our family doctors who's the site director at Rockland, manages that vaccine clinic. In Folsom, Dr. Kim Caffarella, who's the site director there, manages the vaccine clinic. At our Midtown location, Dr. Jane Tsai, our internal medicine department chair, manages the vaccine clinic. And in the south area, at Weimar, Dr. Wendy Lin, who is our site director at Bighorn, is the vaccine director in the Weimar location. So thanks so much for all your efforts. They work above and beyond to make sure that these vaccine clinics run smoothly. And then each of our clinicians who volunteer to work at those clinics, we could not do it without them.
Yeah, thanks so much, John. I appreciate it. So there you have it, guys. This is our first update, and I really hope that you guys continue to refer your patients for the vaccine. We're not out of it yet, and we really appreciate everything you're doing. So you guys have a happy Friday, and thanks for everything.
Thank you.